Dr. Thein is always on the cutting edge of new, evidence-based research and encourages others to maintain the highest level of competency. For this and many other reasons, Dr. Patrick Thein is our recipient for the Values in Action Award for Excellence.
I think the first week I was here, I had the opportunity to meet with Dr. Thein because he was so passionate about improving our laborist program here at Mission. We had a program that was frankly fragmented at the time, providing great service but only on a very limited scale, and we needed to expand that. And he came with data, with passion, just showing me what an excellent program looks like and why we did not have one at that time. And he worked with me as a true partner along with nursing to promote the concept of a 24/7 program, why it was so necessary for our community, for our patients.
As a night nurse, we definitely have special challenges. A lot of times we don't have the ancillary services that maybe day shift does. I think that Dr. Thein is incredibly sensitive to that. A big part of why we're here is because he spearheaded our laborist program here at the hospital. And a huge piece of that is that we now have that service available to us on nights when typically things are emergent and urgent, and it's created a huge safety net here at the hospital and for nursing as well, because we now have an in-house physician that we can rely on kind of as a second eyes, second ears, and there for us to bounce questions off of, so it's been amazing.
He is a physician champion that brings the team together for better collaboration, and that the patient is always at the center of everything he does to make things better for our team, which includes both the nurses and the physicians, but most importantly for our patients.
I had a patient that was really attached to me, and she first baby couldn't see going into labor without me being in town, and by having Dr. Thein, that experience, even though 5 years later, her experience with Dr. Thein put her at so much ease. And that was very special for both myself and my patient, that knowing he even has the ability to comfort someone that he's met for the first time in such a vulnerable position as first-time mom.
He's very clear and concise when he comes to us. If there's a problem, he addresses it in a constructive way. He is the first person to pat us on the back when we've done a good job. He will thank us endlessly at the end of working with him on a delivery, or if we just went in to help somebody and he happened to be involved as well.
But he also strives for best practice, and he brings that to the department meetings. I've been there to witness at their executive committee meeting for their department, as well as a general department meeting, how he just fights for the right standard of care all the way down the line, not just from his laborists, but for the entire department. Really pushing the fact that we should not have different levels of care just because we have doctors in-house sometimes and not. But everybody needs to practice by the same standard guidelines.